More on the healthcare fight. We turn to Nancy Cordes on Capitol Hill. Nancy, some Republicans are already arguing that this plan is way too similar to Obamacare. I think some are calling it Obamacare light.
Yes.
Right? So how strong of a resistance do you think this healthcare plan will be facing from the GOP?
It all depends on how well GOP leaders and the White House sell this plan to their Republican members. The case that they're going to make is, look, this is a huge change to Obamacare. We are scaling back almost all of the taxes. There were taxes on medical device manufacturers, on pharmaceutical companies. All of those taxes are gone, they're going to say. And yet at the same time, we're trying to prevent people from suddenly having the bottom drop out from under them and not be able to afford insurance anymore. Beyond that, they're going to argue to these members, look, if you don't like this plan, there is no alternative. The alternative is the status quo. The alternative is Obamacare. So you need to get on board because this is the only train leaving the station.
Yeah, and it looks like, politically, I know that they want to do something, but the GOP's plan here includes an expansion of health savings accounts. We were just talking about this earlier. What's the Republicans' response to Americans who, Nancy, simply can't afford a separate savings account? When you're living paycheck to paycheck, this seems like a big ask.
Right, and they're aware of that, and that's why they say that these are going to be in place for people, obviously, who can't afford a health savings account, can't afford to put money into those health savings accounts, which are devices that Republicans have favored for a long time because it shows people taking personal responsibility for their own health care. For people who can't afford them, they say there are going to be these tax credits for anyone making less than $75,000 a year, families making less than $150,000 a year, and then the credits phase out after that. Now, these credits on the face right now don't appear to be nearly as generous as Obamacare's tax credits, particularly when it comes to low-income Americans and older Americans. And keep in mind, there was another piece of Obamacare which will now be gone, and those are the subsidies to help people afford the high deductibles in their plans. Those are gone. So Democrats are going to argue that there are going to be certain people who just can't afford insurance anymore. Republican leaders are arguing that they are unleashing all of this competition in the marketplace that wasn't there before, and that is going to drive premiums down and make insurance more affordable.
You mentioned the Democrats are going to argue that some people just aren't going to be able to afford health insurance anymore. Is that the crux of the Democratic argument against the new plan? What else are you hearing?
They say, first of all, it's not going to insure people. Second of all, they say we still don't know how much this plan is going to cost. One of the interesting features about Obamacare was that it actually lowered the debt in the long term. And so the question is, will this plan do the same thing? Already we're seeing one major change from previous drafts of this bill. Earlier drafts simply gave everybody a tax credit across the board, no matter how much money they made. So you got the same size tax credit whether you made $40,000 a year or $4 million a year. That ran into some pretty serious headwinds among some Republicans who said, look, we don't need to be giving millionaires tax credits while at the same time giving lower income Americans a tax credit that isn't large enough to help them afford insurance. The problem now is when you've got these refundable tax credits going to people who don't necessarily pay much tax in the first place, if any, now you have conservatives saying this is a brand new entitlement. You're basically enshrining a new entitlement program. This is not what Republicans are supposed to be about. And so they are opposing it on those grounds. The big question today will be, how firm is that opposition? Are they simply trying to use it as leverage to shift this plan to the right where they can? Or are they really dug in and they are going to vote no matter what?
Yeah, well, we'll see how it all unfolds. Nancy Cordes, thank you so much.
You're welcome.